4.2 million children are admitted to hospital with hypoxemic pneumonia every year. Pneumonia is so severe that your blood oxygen level drops. And these children are at very high risk of dying. I was working in Sudan with Medicines Sans Frontières, and I really saw the impact of not having basic things like medical oxygen when you needed it. Oxygen's not a new therapy, we've used it for over 100 years, but I think we've got a really unique chance to make this oxygen gap history by using what we have in a much better way. So we've been working in 12 hospitals in Nigeria to improve their hospital oxygen systems with pulse oximeters, oxygen concentrators, delivery devices, training and support for technicians and nurses. This project taught us a lot about what you can do. Our next challenge is to take it to scale. So what that needs is investment in the people who use oxygen, so clinical guidelines, training, investment in the equipment and the people who maintain that equipment, investment in how we go about sustainably financing, and investment in how oxygen systems are governed. We've been really fortunate to be supported by a number of donors, including the Bill and Melinda Gates Foundation, and they've enabled us to do this work in a number of different countries at relatively small scale. What we're doing now is working in partnership with the Clinician Health Access Initiative to raise $100 million to be able to scale up oxygen nationally in 5 countries where the majority of children with hypoxemia reside. This will reach almost 2 million children every year, about a third of the global hypoxemia burden among children, and has the potential to reduce their risk of death by half. I hope that when I look back in a decade, I won't need to be thinking about oxygen anymore, because oxygen, like all the other essential therapies, is now available to every patient who needs it, no matter where they are.